In this video, I'm going to teach you about my favorite leg exercise that I have patients do at home. Having strong legs is crucial as you get older to help prevent falls. And 14 million older adults fall each year in this country, leading to 9 million injuries. Falls are the leading cause of hip fracture and traumatic brain injury and currently cause 45,000 deaths per year in the US. And many of these falls could be prevented with proper training, which is why I'm so glad you're following my content and trying to get stronger and fitter. Patients always ask me if they're only going to do one exercise, what should it be? And my answer is the sit to stand. One of the most important aspects to preventing falls and maintaining your independence is having strong legs. There's just no better exercise to start with than sit to stands. You can do them from a couch or a chair at home, and you can make them as easy or as hard as you need to make them. And I'm going to show you all those progressions here in this video. If you struggle at all to get up from a chair, you're going to lose your independence before you know it. And I see this all the time with patients. And once someone is just so weak that they can't get up, living independently becomes close to impossible. Getting stronger at this move will add years to your life if you're not training your legs now, or if you're only walking and biking for exercise. No matter how weak or strong you are, there will be a progression in this video that can work for you. And if there isn't, please reach out to me and I will find you one. Before we start, try the 30-second sit to stand test. You're going to cross your arms over your chest like this, set a timer on your phone for 30 seconds, and see how many times you can then stand up and sit down from a firm chair. Use that number as your baseline. If you're in your 60s, the studies say you should be able to get about 15 repetitions as a minimum. But ideally, I like to see my patients get closer to 20 or even more. You can then use this test to track your progress over time. Keep in mind, when you begin to work through the progressions in this video, the softer the surface is, the more difficult it will be to stand up. So I recommend starting with a firm kitchen chair. Please don't do anything that hurts. Take your time. Always listen to your body, and remember, this is not medical advice. So I'm using just a basic kitchen chair to show you guys, but any chair really works. And if you're fairly weak to start, you might want one with some arms. Some of the variations I'm going to demonstrate here, we have to push off with our arms. I don't have arms on this one, but I'm just going to show you. So you'll notice that I have a couple pillows stacked underneath me. And whenever we're starting this exercise especially with somebody weaker, we want to start as high up as we can. So you'll notice that my hips are higher than if I'm just in a low chair. I have other pads here that I could also put under me if I need to get even higher. These are Airex pads, which you can buy on Amazon pretty cheap and serve a great purpose of stacking under your butt to start this exercise. Also good for drills on the floor if you're going to be on one knee. So from here, I have two pillows. Again, you can use more. The easiest variation is going to be if I'm using my arms, pushing into the armrest from on top of the pillows and coming right up. So it's going to look like that, imagining that I have armrests here. I would work on being able to do about 10 repetitions at each difficulty level before progressing to the next one. So from there, we're going to progress to doing no hands, but staying from the elevated height. So it's going to look something like this. Up and down. As you're working through these progressions, keep in mind that if you need your hands, but you don't want to push off the armrests, pushing off your thighs is going to be a little bit more challenging than the armrest. So that's just something to consider. All right. So as you get stronger from there, you can take away the pillows. We'll take away one to start, and you're going to start moving down. You might notice that as you're moving lower, you have to bring the arms back in. All right, so some combination of moving lower along with hands or not using the hands is how you want to progress down. So let's assume I took the pillow away. I still got to push off with my hands. Build up to doing 10 reps there. Then I might progress to doing 10 reps without the hands, one pillow. And you'll notice that these will get easier, especially in the beginning, pretty quickly. I see patients 1 to 2 times a week, and within a couple weeks, I'll notice that they're getting a lot stronger if they practice them every day. All right, so progressing from there, We're going to take the other pillow away. Now I'm down to a basic chair height. All right, so this is a basic kitchen chair. Again, a softer surface, like I said earlier, is going to be harder. So if you want to progress past doing it to a chair, you can always use a couch, which is going to be harder. All right. So now we're down to a lower height, and you can go from there. If you need to use the arms on the armrest, use the arms on the armrest. So from there, you're just going to keep decreasing the height. Okay. So this is a pretty tall chair. You can go a little bit lower or from a couch. You may also want to consider crossing your arms over your chest. So all along, if you use your arms to kind of give you momentum, that's going to be a little easier if you take the arms out of it. Once you can build up to doing 20 to 25 repetitions without stopping with your arms crossed over your chest, you're doing pretty good. So I have 3 harder variations if you want to get to from there. But again, I think if you're at that stage, we should start practicing some other exercises, lunges, step-ups, and other single leg exercises. 25 reps is a pretty good standard. All right, but if you do want a challenge with this exercise, I have 3 different versions for you. The first one, and I love this with patients once they start getting pretty strong, is a staggered stance. So what I'm going to do is I'm going to put one foot in front of the other foot. This is going to bias the leg that's closer to you with that side foot back. So this is a staggered stance, sit to stand. Up and down. So most of my weight is on my right leg and right foot. You'll notice that this leg is taking probably 75% of the work, depending on how much you push with the other side. I would do both sides. From there, you can try a true single leg squat from the chair. This is not easy. I don't think it's necessary to do, but I'm just providing it as a harder variation. So from there, we're just going to lift one foot off the ground, come up, and right back down. If you get pretty good and you want to just start by trying this from a higher height, you can add your pillows back in. It's a great single leg exercise that you should be able to do. The one other harder variation is just to grab some weight and do essentially a weighted squat. So I'm going to hold my kettlebell right here, down and up. The best part about this exercise is that you can do it at any time. So there's just countless ways to incorporate it into your week. You can do 3 sets of 10 to 20 reps as part of your workout 3 days per week. You could also just do 1 set of as many reps as you can, 1 time per day, every day. Or you can mix it in throughout the day. That's a great thing to do if you're retired or you work from home. Just make it a point to do a few reps, a few different times while you're seated. You can decide which of these options works best for you and just get started and be consistent. Let me know if you have any questions about this exercise and I'd be happy to help you out. You can find me on social media at TheFallDoc, or you can email me at johnthefalldoc@gmail.com. Thank you for watching, and I can guarantee your future self will not be disappointed if you add in this exercise and just continue to get stronger at it over time.